Welcome again to another episode. A Smile is in the air, your oral health and prevention podcast. I'm Celso da Costa, and with me today, I have the pleasure to have a good friend of mine today, Dr. Hugo Madeira, the star dentist in Portugal. This guy is everywhere, magazines, television. I start getting tired of your face, actually, because you are always outshining me now.
But Celso, first, thank you for the invitation. It's really a pleasure to be here. But man, it was you that invited me, so it's your problem.
It's true. It's true. I need to say that he has also a Portuguese podcast. That is what is the name? Unicorn.
The name is the
School of
Unicorns.
Yeah.
Yes, and I want to invite you one of these days. Also.
Oh, for sure, with pleasure. I will be there because I can have the pleasure to talk in Portuguese after. So you are at IDS. Why invite you? Because you have your clinic in the middle of Lisbon. And you have 3 GBT lounges today, right? Why you shift to GBT? That's the first thing, because it was a good story and we tell it last night again. And why then to have three rooms completely dedicated to GBT?
Well, first, again, Celso, it was your fault. First, it was Celso that presented me the concept. And for me, what I really care in my clinic, in my daily practice, it's the experience that my patients take at the end of the day. And there were some patients like really complaining about oral hygiene, that sometimes could be like a treatment not so comfortable. And really, when Celso and the EMS appeared with presenting this new concept, and I really was the patient, like here today in the IDS, like the patients are the dentists in your life. In your life practice, and I really tried, and it was so comfortable and less invasive because all the power and the vibration of the piezo and the warm water. Like I really loved it at the first moment, and I want to install it in my practice like for the day after. And so like from 1 to 2 to 3, it was very very quick. This augmentation, like this raise of cabinets, and also the project that is coming. Because we're gonna switch like from 3 to 6 GBT rooms in a few months, and I really think that the patients, they need this. It's like it's more than like it's. Some of people say, it's a detail that's maybe necessary, but no, because prevention is everything, in our health, like also in dentistry. And if we can provide a good experience in our prevention, we don't even need to think even one day to treat the disease, because it's never gonna come. So,
exactly, and that's what you are based your practice today, right? Yeah. So that first day that I met you in the practice, because we were presenting GBT to Marta, for example, I said, no, you need to try it. And I said, no. And I grabbed it by the neck and said, no, I try it in your mouth. And all of a sudden I said, oh, finally, I want 4 devices. We started with it. And since then, the full team, and we have here Diana, for example, we have Professor Antonio Mata. They really believe that prevention is the best medicine. Right, and you are explaining this to the patients.
Yes, and I think this takes some time, like to really change the mindset. We know that people are very against changes. And I think like in health and in dentistry even more. So like from the moment that you present something to the dentist or to an oral hygienist, and he wants to really change and implement that in the daily practice, it takes a while. But with GBT, it was very quick. I can compare this a bit with the shift from conventional impressions to digital impressions. That took me already, I think, a year and a half to really implement this with my team, because the dentists, they didn't want to change. Okay, it's more complicated. I'm gonna take more time. I'm used to do like this, and it works. The GBT, it was much more quick. At the beginning, I remember some of the hygienists, but I'm happy with my practice. But when they tried, it was no turning back.
Once you go GBT, you don't go back.
No, you don't go back. And really, and for the patients, at the beginning I thought, okay, this can be difficult to explain to the patients. Okay, what is different here in practice? Okay, my chair it's pink. My chair it's pink. It's more comfortable. Okay, I have the disclosure process. It's a bit more. I think it's a bit more educational and motivational, and that's really important for the patients and for the final outcome.
Yeah.
But really, I think the comfort that patients experience, it's really what makes them like, okay, I want this all the time. And sometimes they arrive to the clinic, okay, we don't have the normal oral hygiene anymore. But I know cases from other clinics that they use GBT and they use like conventional prophylaxis. And the patients, they say, okay, I prefer to wait 1 or 2 or 3 weeks more to have the GBT appointment.
The GBT.
Yeah.
Because you are known by this makeover that you do in television with these super hard cases. And we were talking I think it was 6 months ago, and you said, yeah, now I can maintain the work that I'm doing at 100%. So was that the main point? Is also that's why you said people want to come back, so you need to maintain this big aesthetical work, right?
Yes, because after a big intervention, like those cases like full implants, full veneers, whatever, we really need to ensure that's going to remain like perfect long term. And with GBT for implants, for the veneers, it's like a game changing, completely, because I'm pretty sure that my ceramic is going to remain perfect. I'm not going to have like any risk from the piezo, and it's even safer because I knew sometimes, okay, I can have hygienists that I know that they are a bit more strong in the patient's mouth. And in this case, everything when saying that it's important in our life and when we have a big practice, it's to have protocols. And to have an uniformization of practice. And with GBT, I know that all my hygienists, or even my dentists, if they do oral hygiene, they are doing the same, and it's always the same. I don't have like this thing, I prefer the A or the B or the C doctor. No, everyone is providing the same kind of treatment. And that is like service in the end of the day.
But that's a bit. My wife is one of your patients, so she's doing clear aligners now, and it was funny. But at the reception, the receptionist asked, "Hi, you're gonna start the clear aligners. Have you done the GBT?" And she laughed and said, "Yeah, my husband does the GBT for me, so don't worry, I will do it." So you train also the receptionist team how to explain the procedure to the patients. How they took it?
Actually, we try and we train all our team, but even before the receptionists, we train our we call it smile managers, the people that talk with the patient. But even before a patient or a potential patient to arrive to the clinic and start to have a conversation with us online. And so the people that contact with the patients online by social media, by email, or even by phone, they are ready to answer all the questions about the GBT, because there are patients that call, "Oh, I know you have a new technique, how it works." And so it's like we can lose a potential patient if we don't have the right speech in that moment. Okay. And by the way, thank you for the trust of putting your wife in our practice.
No, I trust you. You know, since the first day that we met, then we developed this friendship. So honestly, I trust you 100%. And I have to ask this question. Actually, this question is coming for some people from my team, and they ask me, "Do you only employ models at your clinic? Because everyone is beautiful at your clinic."
It's your eyes also. It's your
Oh no, I don't think it's my eyes. I don't think it's my eyes. I think it's the smile. Everyone receives us as a smile. We always felt welcome at your clinic. I brought like 2 product managers with me the last time, and we were received with such a breakfast that I said, "Okay, never again, people. You don't come with me, and otherwise you're gonna think that this is always the same thing here." No.
It's Portugal. Sorry, Portugal. We like to receive people also.
Okay, that's a good answer.
And about the beautiful people, the models, it's because people that work with us, they are so happy there that they shine. That's why the beauty.
No, exactly. That's a good answer. Not because I'm Portuguese, but because I'm good looking too.
Yes, that's true.
No, that's good. Hugo, thank you so much, and thank you for the visit. That is really nice to enjoy a cup of coffee with you, or tea or water in this case. Enjoy the visit at IDS. Let's do this for the 6 rooms. And this is funny. Like, you started with 3 rooms. Now you have 4 because you have one that is working also at Implantology, and you are doing this jump for 6 GBT rooms. Thank you for that. Keep the good work, and I will be here for helping.
Thank you, Celso, for your kind words. It's really nice to have this partnership with you and BMS. It really changed our practice, and it's really like a long-term relationship for sure. Yeah. And GBT, it's really what all of us want to make, like, in dental world till the end of our lives, no? Because we really want to prevent our mouths to have the diseases.
Yeah.
So, like, let's control it, prevent it, and to have like a good experience.
Yeah.
So in the end of the day, we all can have fun doing GBT.
For sure.
No?
For sure. Yeah. That's the thing. This is fun. This pink is fun. You hear it here by Hugo, so it's because everyone in this clinic has a good smile. That's why they look so good. Prevention is the main topic now in the clinic, so stay tuned. Don't forget to subscribe our podcast on Apple Podcasts, YouTube, or Spotify, and don't miss the next episodes. Thank you. Bye.
Bye. Thank you, sir.